$1 million. Yeah, exactly. And I think if well, I was going to you see my company, Social Security.
Yeah.
Still with that.
Yeah, I know.
Would you mind doing a lot further before? That's one of those things. But I think embedded within that is that we're trying to get to Karen. I'm saying I'm sure I can aware of she is. But I think embedded within that is probably should have to drill that into the free car. It's so that is much better. Next time two studies up here, then I would like for us to get some expert opinion about the basketball. So there, I think it's bring together resources. I think it's open source.
Yeah.
That's yeah, it's a big data. So I'm sure. It's got to be open source. Really.
You do that, right? I mean, good practice. Thank you.
And that's it. Yeah, it's not there.
I saw words.
Megan, can you hear okay?
Yes, I can. Thank you.
Hi. Waiting another minute or two while people are getting settled. So
Okay.
it sound really loud. So
Okay. Thank you.
So actually today is kind of like, I just really kind of found it out Monday, we're still just internally. Sir, see, at least the weather's starting to break a bit. How are you, man?
Great.
Didn't get a chance to speak to you earlier in the Commission on Aging.
Hey, Rob.
Yeah, it's just been one of those days. I've been literally back to back. I'm just gonna run from one thing to the next.
So she's still the ERS director as well.
No.
So who called you guys again?
We don't do that.
So
Yeah, I think it's just really just, and I don't know what the time, it's just kind of during this transition and then through, and I'm sure we'll get, more details as they get settled in, to their roles. Get their feet grounded.
But they didn't under something.
Sound like.
Actually, also.
Wow, how many days do you have? No. She's social.
Yeah.
Oh, it's a time.
Sorry. Yes, Representative Claire has.
Megan, I think it's okay to get started.
Was it me?
Oh, your fault.
Okay,
I don't know if I can find a place to sit.
1 second. Okay. Okay, dokie, there we go. Okay, sorry, I was doing 4 things at one time. All right, we can go ahead and call the meeting to order here. We'll do a roll call first. So again, my name is Megan Smith, present. Is Jim present? No. Senator Ed? No.
Talking about me. Representative Ed.
Yep, Representative Ed.
Yeah, this is Ed Clear. Thank
Okay.
you.
Senator Lucretia?
Yes.
Representative Carolyn? Dr. Joanne Burke? Oh, we see you, Joanne, but we can't hear you, hon.
There you go. Now you
There
can
you
hear
go.
me. Thank you.
Stephanie Anderson? Jacob Sipe?
Yes, I'm here.
All right. And Giovanna War? Okay, I think that's all of our roll call, which means we do not have a quorum.
I'm sorry, did you get me as present, Senator Jackson?
Yes, I did. Thank you. Okay, I'm not sure we have a quorum here. However, we can go ahead and move forward with our agenda. So we can't do any meeting minutes due to obviously not having a quorum, but we can go ahead and start with our first presentation here. Age Forward Together, update on Indiana's multi-sector plan.
Hey, I'm sorry. I've been having audio issues for days and I keep having to restart things to get up and running. Apologies. It's so great to see you all today, even if it is virtual. And let me get my camera up and running as well. It's good times with technology over here, let me tell you. Okay. Hopefully you can see my face now. Or at the very least, my slides, which are way more important.
Yes.
So very nice to meet you. I feel like I probably have met most of the people in this room, but just in case. My name is Vanessa Convard. I am the Service Enrichment and Advancement Director for the Division of Aging, which means I manage several programs for the Division of Aging, including our education and outreach efforts, which is where the multi-sector plan on aging falls under, as well as our adult protective services program, and our PASSAR/LCAR program. So yeah, very nice to meet you all. So today we're going to be focusing on our multi-sector plan for aging, which we call Age Forward Together. That's the Indiana name for it. Since so many different states have a multi-sector plan on aging, we have each come up with our own state version of that name to help differentiate between the different programs. They are all very much tailored to each state, which was the intent of the MPA when it was first initiated. To give you a little bit of background info, because I'm not sure how much information you already have on the multi-sector plan for aging. This was started, I want to say about 3-ish years ago. It is a new initiative from ACL. It is meant to eventually be nationwide. So we're aiming for every state to have their own multi-sector plan on aging. We are of the first cohort. There were 10 states, sounds right. Might have been a little bit less that were chosen for the first cohort for the rollout of the multi-sector plan on aging, and we were in that first cohort. So we get to lead the progression in this area, which is fantastic. And we work really closely with the other states, especially in the first couple of years. We were meeting like every month to, share ideas and talk to each other about what we were doing and try to support one another's plans. But we are now at a point after this past year of diligent work with several stakeholders, which we will show you a slide for here in just a minute. We have developed the specific plan for Indiana. So we're going to talk a little bit about that today. I will give you a heads up that these are wordy slides, lots of words, because we know that these slides are going to be eventually going out to a large audience. And so we just wanted to make sure people had as much information as possible. But I will not be boring you by reading every single word on every single slide. We are doing an overview today, and then you will have the slides available to you to go ahead and, do that deep dive and learn more about what's going on. And I would also like to just take a moment. I meant to do this on our meeting earlier and honestly spaced it out. But here is the email for the Age Forward Together plan. So if after we get done here, you have any additional questions later, if you go home and I'm hoping you're not thinking about work on your drive home, but if you are, and it comes up and you're like, I have a question, this is the email that you'll want to use, or if you have any suggestions for support or extended stakeholders, whatever it might be, please feel free to reach out to that email. So what we're going to cover today is developing a strategy to meet the needs of Indiana's growing older adult population. What exactly does that strategy look like for us? Understanding our current state of aging, mapping our approach to developing the MPA, and we're really going to dig into what the key focus areas are that we were looking at when we pulled all of our work groups together and developed the strategy. We aren't going to go into the details of the plan in this particular presentation. We still have some approvals and refining that we need to do before we can present that, but I promise I will be back to talk about it as soon as we have that for you. But we are going to give a good overview of the strategies that were discussed. So this is probably your most important slide just because it's the one that's going to, give you your summary of everything else I'm about to talk about. We all know we have a growing population of older adults in Indiana. This is not a group I need to lecture on about that. You are very well aware. And the purpose of the MPA is to try to meet the demands of that growing population. We are trying to take when we say multi-sector approach, I'm talking big. We are looking at not just government, not just nonprofit. We're looking at private. We're looking at banks. We're looking at schools. We're just all over the place. And we really worked on being very creative in our stakeholder engagement. So trying to think of stakeholders that maybe we haven't previously engaged with to do this kind of work, but who definitely affect the older adult population and how comfortable their lives are, right? Because that's what we're looking for here. We're looking health, we're looking comfort, we're looking decisions. We're just trying to make the aging environment a good place to be in Indiana. The overall population is increasing. You know this. You can tell from this graph, over 26%. It's big. It's a big number. This is coming fast. 15 years, it's not that far away, right? That's tomorrow. Like that's any day now. So it's really important that we start establishing these strategies ASAP. The multi-sector plan on aging is meant to be a 10-year plan, which we are now just 3 maybe years into. And not to say it ends at 10 years, that is not how that works. But we hope within those 10 years to have our strategies, at least a foundation for those strategies established so that we can see it grow past that. And then when those 10 years are up, we'll see what comes next, right? Probably just revisit all of it and revamp all of it. This slide just gives you a good idea on the county level of what that growth looks like. You can see here with the growth of the 5 bigger counties, or the 5 counties that'll see the most growth. Big, it's huge. I don't want to spend too much time lecturing on you on this, but we just cannot forget how large these numbers are. As you can see right there, it says top 5 counties are going to account for 40% of the state's total growth. My goodness gracious. So we need to be prepared, and we need to have an environment that people want to age into.
Does the darker green on the map correspond to the darker blue, and it looks like black or navy on the scale?
It does. And the reason that the colors look a little different here is simply because we are in the midst of a rebranding with FSSA, moving everything from green to blue. So we just haven't had a chance yet to dig into the map itself and update those colors. But yes, it does.
So darker means greater growth in 65 plus population by 2035.
Absolutely. Yes.
Why are we moving from green to blue?
I don't know. I don't know, but I will say that I like the blue. Just a fan. It's a really nice shade of blue.
Oh,
If I may,
That's the decision above my pay grade, as they say.
I did a study. Green means family, community. It's a thing behind blue means those.
Oh, interesting. I had not heard that. Okay.
In the nonprofit world, so our colors
Yeah.
are we ditching? Does this mean we're ditching the InConnect network?
No, this is separate from that. So
Okay.
the multi-sector
Curious.
plan on do you just mean the green of the InConnect, or?
Well, the name and all that.
No. No. That's a separate kind of and the Age Forward Together branding is continuing to be green. It's just FSSA stuff is blue. And when we originally created these slides, which was just last month, it was still green. And so we're still in the midst of trying to change everything to blue. It's just that simple. Yeah. It's a process, let me tell you. All right, so go ahead. Yeah, thank you. Go ahead and jump to our next one. So as the number of older adults increases, we got to be ready for that, right? So we're looking at 52% of Hoosiers, say 65 and up, having multiple chronic conditions. How are we going to be ready? We need to have increased support for our intergenerational workforce, which is one of our major goals, and we'll talk about that again in a moment as well. Yes, there is an ongoing financial strain. I am not a huge fan of focusing too much on the word strain. There is, we have to be honest about it. There is going to be some financial stuff that has to be sorted out for sure. But I also want to keep in mind that there is not just a financial strain coming, there's also potential financial benefits coming. So that's part of what this plan is looking at is how can we make sure to incorporate that in order to curb any kind of strain. And there's also an opportunity for greater inclusion, for being able to integrate all of our generations in all kinds of programs, right? How do we bring our older generations and our younger generations together? how do we incorporate everyone in our volunteer work, in our work? This is something that we delve into as well. It gives us a good opportunity to bridge some of those gaps that exist societally speaking. We have a tendency to have a divide in age in our society. We have a lot of ageism in our society in both directions. So how do we bridge all of that? How do we bring those people together? And we also know that aging isn't a thing that happens when you turn like 55 or 65 or that's not how aging works. Aging happens the day you're born. Now you're aging. Okay, that happens as we go old. As we go old. What was that? As we go on. I'm sorry. I've had 4 cups of coffee. Bear with me. And so we need to be looking at it from that aspect. We need to be looking at aging as something that is happening throughout our entire lives, so that we're not waiting until we're in our mid 40s to prepare for quote unquote aging. Like this is a forever thing. So here we're going to take a look at like our the specific framework for our MPA, for the Age Forward Together plan. So here, again, looking at that cross-sector strategy, it's absolutely critical. You can actually see on each of these slides, I should have brought this up sooner, but you can see on each of these slides that it not only shows the FSSA branding, but also AARP. And that is because AARP was absolutely critical to getting this launched, to getting this off the ground, and will be critical to moving it forward. AARP did a lot of foundational work, just laying the groundwork for the kinds of strategies and pillars and categories, areas that we needed to be paying attention to. Did a lot of the initial research, the quantitative data. They pulled a lot of that together so that states could base their MPA off of something quantifiable, something real, some good data. They were also, our Indiana AARP worked very, very closely with us to pull together these stakeholders and to move these work groups through the very difficult task of coming up with the MPA strategy in a short period of time, and then putting that together into a usable plan. So absolutely could not have done it without them. So again, our Age Forward Together, we are looking at strengthening existing initiatives. So we don't want to reinvent the wheel if we don't have to. There are certainly some strategies that were brainstormed that are new. Fantastic. If we can get the resources together to roll out some new and necessary initiatives, we are absolutely going to do that. But we also know there's already so many really great existing initiatives. So we want to really focus on supporting those, growing those, bringing different stakeholders together to see what we can do to make those successful. Again, it's a 10-year horizon. So that's how much time we, theoretically have to pull it together and get that foundation going. And again, with the cross collaboration, I'm going to say it over and over. So bear with me there. But it's just critical. We can't do it without having this cross collaboration. This is not just DA. You're going to hear us talk about it a lot. You're going to hear us, doing road shows and planning things and pulling people together. But the actual Age Forward Together plan is absolutely a multi-sector project. It's just not something we can do alone. There's no way. We're talking statewide. We're talking various levels of involvement. So we are definitely going to need to maintain some excellent stakeholder engagement for this. And in our next slide, you actually see who those stakeholders are at the moment. So these are the groups that came together to provide the strategy that was actually developed. So we provided them with an idea of some key goals and some pillars, and they ran with it and came up with some fantastic ideas for what we can do with our Age Forward Together plan. This slide is mostly to show you how pretty it is when we put a puzzle together as a group. We constantly talked about the importance of teamwork here. Integration is, again, another word you're going to hear me use over and over and over again. This is about integrating stakeholders. This is about integrating older adults. This is about integrating people into our work, our volunteer work, our community work, our schools, everything. So we're talking a very global look at this plan. And in our next slide, you'll see what our key goals that we base this on, these key goals, which we came up with pillars for those goals, objectives for those pillars, initiatives for those objectives. Your classic strategic plan there. And in the next one, we take a look at what those actually are. So our goals were an age-friendly communities, reducing barriers. That's reducing barriers to healthcare, to education, to work, to everything. Making sure that each journey is supported. So whether someone wants to continue on in the workforce, wants to get more involved with the community, wants to be a volunteer somewhere, or wants to continue their education some way or another, formal, informal, or if they just want to be really ingrained with their community in some way, we wanted to make sure that there was a path laid out for all of these options. And then another work group we had was focusing on reframing aging. So taking a look at how we talk about aging, the language that we use, really diving into what ageism is and how it affects our communities, and taking a look at ways that we can combat that. So let's go into each one of those goals. And each work group was based around a goal. So people would come together and focus very much on that goal and those pillars and those strategies. So we had 4 different work groups together with those stakeholders. So I'm going to highlight in the next 4 slides the different statistics that we have here. I'm sorry, would you mind going back to the age-friendly community? Thank you so much. So here we focused on the pillar of economic opportunity, where we see that 49% of older Hoosiers reported challenges affording daily expenses. That's no good. People should not, anything we can do to prevent people from, struggling to pay for daily expenses, we would like to do. And then, of course, livability factors. And this is based on the stat of 59% of Hoosiers age 55 and plus rate their communities as residential and commercial areas to be good or excellent, which we love and would like to lift up, right? Like 59% is a solid number. Let's get that even higher. And then for reducing barriers, our pillars were access to information and health networks across the aging spectrum, community supports for aging, and support for healthcare provider ecosystem for older adult care. So we know that today, 38% of adult Hoosiers reported problems getting the healthcare that they need. Let's reduce that barrier. We can find ways to get people the healthcare that they need or get them to their healthcare. 34% of older Hoosiers rated the availability of affordable quality housing as poor. So that's not great. We can do better there as well. And 87% of residents residing in rural areas experience primary care shortages. I'm sure you are well aware of the shortage of primary care that we have here in Indiana and really across the country. It's a bit of a struggle to get a really good number of primary care providers, particularly out in those rural areas. So looking at how we can either, leverage technology, transportation, et cetera, to try to either get providers to the people or get the people to the providers, but finding a way to reduce that barrier, because we all know that, primary care is such an important piece of preventative to chronic health issues. So what can we do there? And then for each journey supported, we looked at workforce support, volunteerism and civic engagement, lifelong learning, and community ties. So 39% of older Hoosiers report challenges with finding employment. That could be for a whole variety of reasons. It can go back to transportation. It could go back to the ageism discussion. There are so many reasons why somebody might be struggling to find employment, and we need to take a look at each of those areas and see how we can combat that. 31% of Hoosiers find it challenging, 31% of Hoosiers find challenges with getting meaningful volunteer opportunities. So they would like to be more of a part of their community. They want to volunteer, but they don't know how to get to where they would volunteer, or there's no available transportation for them, or they're simply unaware that it exists. Again, so many things we can leverage here by coming together, all different stakeholders, and figuring out how we can make sure that people are able to get to the volunteering that they want to be a part of. 33% of older adults rated opportunities to enroll in skill building classes as poor. So again, there are things we can do. There are ways that we can expand the options for education, again, non-formal or formal, and get people access to these things. 39% of older Hoosiers report feeling lonely or isolated. So again, finding ways to bring people into their community or get the community to them. How can we enrich people's social lives and make sure that they know that they are still a valuable part of their community and that we want to be a part of their lives? And then our final one here is reframing aging. Our pillars here, we're changing the narrative and care and support. So 55% of older Hoosiers do not feel that older adults are valued in their communities. We were just talking, I mean, you'll see all of these really just overlap with one another. So what can we do? What can we do to make sure people do feel valued and know that they are valued? And let's be clear, the value is high. I, again, don't need to lecture this group about it, but the value that older adults bring to our communities is enormous. There is an economic value. There is the wisdom of life. There is simply having different experiences and learning from one another and our different experiences. There's so much value here that we are not tapping into. And that goes back to what I said before about strain. I don't like to, we have it the one time in the one slide because it is something that we have to recognize, but it is certainly not the focus because there's so much value that we haven't tapped into yet that will curb that strain. So how do we do that? 42% of Hoosiers provide 20 or more hours of care per week to another individual. I mean, part-time work here. So how do we support them there? How do we make sure that they are still able to get everything that they need while caring for other individuals? So important. Our next slide is just gives you a good idea of all the different sectors that we are working with for this plan. So we have governmental entities, we have businesses, we have legal and banking institutions, marketing and advertising groups, communities, different community organizations, different health systems, and all sorts of public spaces. So we're really trying to go big, right? Go big or go home. We're trying to tap into every possible area that we can to support this plan because this is a community effort. So our next steps are to promote the MPA across the state, to increase awareness and build buy-in, to begin efforts to collaborate with key stakeholders on implementation plan and objectives and initiatives, and to improve accessibility of existing aging data and data sources in Indiana, because that data piece is going to be key, right? We're talking about putting a lot of time and energy into this project over the next 10 years, into multiple projects over the next 10 years. And we want to be able to show quantitatively that these different initiatives have improved the lives of people in Indiana. So that is the goal. Our call to action is to ask that people share the MPA with anyone you think might be interested in being a part of it. We're going to be here soon scheduling some listening sessions and regional meetings. We're going to do a road show. We don't have that scheduled yet, but it's on the very soon to do list. So once we get all of that up and running, we'll make sure that you stay informed as well, but promoting people attending those and then providing any feedback that you have to us on how to engage or who to engage in the next few months. We are here for that feedback. Please send anything you have to that email and we will take a look at it. That's going to be critical, especially for this first year when we're really trying to gather people together and roll things out. So please do not hesitate. And that's all we have for today. Do I have any questions? I really appreciate your time.
Yes, this is Representative Jackson. Thank you so much for your presentation, but I do have one question.
Sure.
I noticed that in all your information, you refer to people 65 years or older and your expectations in terms of the cost of living as well as the cost of care and how it's going to increase within the next 10 to 12 years. But
yeah.
I've noticed that we're getting more and more individuals who are just under that 65 years of age who
Yeah.
are suffering and in need of a lot of medical care, dementia care, and all of the necessary health care that would prevent them from, in some instances, from living at home on their own. Have you all taken that into consideration?
Oh, yes. Oh, yes. Thank you so much for bringing that up. That is something that we have been taking into consideration. And it's part of why I bring up the comment about how aging is not a thing that happens at a certain age. It is a forever thing. It is happening from the time we are born because we are seeing some of these chronic issues happening earlier and earlier. Dementia is an excellent example of that, but we're seeing it in a lot of, well, maybe all chronic health issues are happening at earlier ages. So what we think of as aging, that's happening at an earlier age. And a lot of what we think of as aging, as far as chronic health goes, it doesn't have to be a part of aging. Like it's become something we're so used to hearing that we think that this is a natural part of aging, but it doesn't always have to be. So a lot of the focus that we had in our different work groups was on preventative actions, like what can we initiate to help prevent these chronic health issues, to help prevent these things that we think of as quote unquote aging, of how to make sure that people get to age in a healthy and happy, comfortable way. So that was definitely an important part of the conversation, and I really appreciate you mentioning that, especially that specific example.
Okay, so since it has been considered and everything, I'm guessing I didn't see anything in any of your slides, but I'm just wondering, could you give us an idea how that's going to affect the program right now? Because because I've noticed, for instance, in those senior citizen homes, I was just there I've been to several within the past couple of months, and I'm seeing more and more people who are in their late 50s than what I have ever seen. I mean, not that I I make it a habit of going by there or anything, but it's getting to be a epidemic. I hate to put it that way, but that's the best way that I can put it. And those individuals are in need of serious help. And those individuals that are they can't turn them away. I'm sorry. And the individuals that are older, that would put a strain on the care that they would receive.
Absolutely. Absolutely. So we do have an initial strategy developed, and we have gotten that approved by the previous governor, so that we can move forward on putting together some work groups. But I don't yet have an actual deliverable that I can show you, but I will have that very, very soon. So bring me back. Have me back here in a couple months, and I will have something that I can show you to give you an idea of what we're planning out. Now, I will tell you that what we have developed now is really just a solid idea list, right? Like what we came up with were some strategies that we thought were reasonable things that could be implemented, or things that already exist that we think it's reasonable to provide support for. There isn't anything on there that's like an enormously huge and new initiative, because we just aren't ready for that yet. But everything we do have are like solid strategies that we already have evidence for, that are good programs that will help to encourage health and well-being and emotional well-being of our population. I even hesitate to say older adults, even though that's the focus, because it's the whole point of it is that it's bigger than that, right? It strengthens the community as a whole in a way that benefits older adults. But we do have some really solid ideas that came out of those work groups, and I do look forward to sharing those with you. So please have me back.
Thank you. I look forward to getting that information.
I have a couple of things. First of all, thank you for your presentation and your work on this. The plan is was an initiative of the previous administration. So do we know whether the new administration is fully committed to it?
Not as of yet. We have not had the opportunity since, it's been like 4 days. So we haven't yet had the opportunity to present it to them, but we feel very, very hopeful.
Okay. Well, let us know if there's anything we can do to support that. I don't want to speak for the other legislators who are here or who aren't here. I know Senator Jackson is here in person, and Representative Jackson is online, so they may wish to weigh in. But I know as a legislator, I would be happy to express my support for continuing this initiative going forward.
Yes,
I so appreciate hearing that.
I'm sorry, this is Representative Jackson. I too would be very interested in supporting as well.
Senator
That
Jackson
absolutely makes my day.
You
I'm
got,
excited.
Senator Jackson would as well.
you've got Claire and the Jackson sisters.
That's
And again, I don't want to speak for anybody else, but I would think there are other stakeholders, probably including some who have representation here in the room today, and maybe others who are tuning in online, who could also be helpful in expressing support to the new administration to make sure they understand the work that has gone into this, and the value of moving forward with implementation. So I would urge you, Vanessa, to look to stakeholder organizations. I know I4A we're going to hear from in a little while, and I know there are a number of, I don't want to call out other names who aren't here, but I know there are a number of stakeholder organizations that would probably be willing to weigh in if they were asked to.
That is the best news I have heard all day, and I mean that. So thank you, because I really do think that support is going to be critical. And I will definitely let you know if that ends up being something that we need like more verbal support on. Thank you.
Yeah. Well, let me know if I can help coordinate that. I'd be happy to facilitate communication among the various stakeholders and other legislators who are on the choice board, and possibly other legislators who aren't on the choice board but may have an interest in expressing their support as well. I just think it's important to have that support in hand when you make whatever sort of pitch or presentation you're going to make to the powers that be in the new administration.
Thank you so much.
And then I assume we're going to get the slides that you presented.
Yes, and by the way, you will see, like, I have presented on slides 1 through 20, but there are actually 41 slides total. Slides 21 through 41 are all just the supporting data that went into the first 20 slides. But we just wanted to make sure you had that information in case you wanted to do a deep dive. You wouldn't have to do your own research. You'd have it right there in the slides.
Thank you. Has there been any discussion of legislation that may be necessary along the way to facilitate implementation?
We suspect at some point that's going to be a thing, but we don't specifically know what that looks like yet, where that's going to occur, if there's going to be funding that's asked for. Those details we do not yet have.
Sure. Is there anything in your timeline that requires legislation sooner rather than later, including in the current budget session?
No.
Okay.
Luckily, we've got those 10 years, so we've got a little time to strategically plan that out.
I'm sorry, I couldn't hear that. You've got what in there?
Oh, I'm sorry. Since we've got a 10-year plan, we've got a little bit of time to strategically plan that out. So that doesn't have to be a this year thing.
Sure. Okay. Well, again, thanks for the presentation and all the info.
Yes, thank you.
Any more questions for Miss Vanessa? Nope. Okay, well, awesome presentation. Thank you so much. I think we're all interested in learning more about this, and especially with Senator Jackson, Representative Claire, and Representative Jackson. We're all interested in hearing more about this. So thank you very much. Okay, so let's move on to our next order on our agenda. Our updates from the Division on Aging at FSSA, Ms. Erin Wright.
Afternoon, Erin Wright with the Division of Aging. I'm the Director of Access and Engagement. I just have a few short general updates today. Within the Division of Aging, we're focused on continuing our day-to-day responsibilities and support to our programs and partners and individuals we serve as we're working through the leadership and administration transition. Everything is very new, and I would like to share that Kelly Mitchell has been named as our interim director in a dual role. She is currently also the director of the Division of Disability and Rehabilitative Services. She's here with us today, so thank you. And we are looking forward to working with her. We don't have a lot of information at this time about the changes that are coming as we go through the transition and what things are going to look like, but we are here. Wanted to talk a little bit about something we've been working on for many months, and that is the process for the upcoming cycle of the area plans on aging. This is a requirement under the Federal Older Americans Act for the AAAs to maintain their designation as an area agency, and we generally follow a 2-year cycle. Our last full plans were done in 2021 to cover federal fiscal years 22 and 23. And then we did an update plan for 24 and 25. So we're preparing for a next full plan cycle for 26 and 27. And these plans really highlight each AAA's efforts in their local areas. One related to alignment and compliance with the Older Americans Act, but it extends beyond that and includes choice and other programs and initiatives that are going on in their local areas. So we will be issuing the guidance and templates to the AAA network hopefully within the next couple of weeks, and then they will be due to the Division of Aging at the end of May, will be reviewed over the summer, and will go into effect October 1st of this year. With the Older Americans Act, and I think we've mentioned in past meetings, there were new regulations released this past year. So as we've been working on the process, we're trying to incorporate some of those changes. And we're also trying to highlight areas that are in alignment with things like the multi-sector plan on aging, our current state plan on aging, the dementia strategic plan, just to ensure that as there are these different plans that are serving different purposes, they're all at least in some way connected. So we're moving forward in the same direction. So working on that. Couple updates about choice. I pulled the waiting list numbers yesterday, and there are 2,926 individuals on the waiting list currently. This is up about 20% since July and up about 800 people from this time last year.
You said 2926?
2926, yes. Again, the reason, note, I said again because this is consistently what it's been. The reason that is noted is lack of funding. As we've done in past years, we will soon be looking at the choice spending to see if there are any areas that are projecting to underspend and some that look like they could use some additional resources to explore the possibility of amending the grant agreements to move some funding around. We only have claims for the first 5 months of the year so far, and we are actually right at about 40% spent of the 29.3 million, which is exactly where we would expect to be at this point. There are about 5 AAAs that are spending quicker and a couple seem to be underspending. So we'll be getting the next claims towards the end of the month. We'll be reviewing them in early February, and then we'll be able to look at, see where we are and see what we might be able to do to try to get the resources where they're needed.
So not an overall lack of funding, but a lack of funding that's been apportioned to various AAAs.
Well, there's the waiting list that's growing.
Right.
So.
But we
Yes.
still have 5.5 months left in the fiscal year.
Right. And
Right.
the claims we have are only for the first 5 months. So there's 7
Right.
months of spending. So, for example, one of our AAAs has spent nearly 3/4 of their entire allocation. So without additional resources, they will likely run out of funding in the next couple of months.
So is that AAA putting people on the wait list then?
Yes, I believe so.
So,
Yes.
so is, maybe I didn't state my original question well. We're not out of choice funding.
No.
Right. But
We're on
but-
track to possibly
but
have those waiting lists keep growing. Yes.
but the waiting lists, why is the waiting list growing if we still have funding? Is it that certain AAAs have used everything they've been allocated up to this point, so they're putting people on the waiting list?
Yes, so if they're putting, well, I shouldn't say yes, I want to make sure I'm understanding your question in my response. So if I'm not answering your question, let me know. So individuals will have X amount of people on waiting lists or on service plans to get.
You mean AAAs, not
Yeah.
individuals?
AAA.
The AAAs will put individuals on the service
Right.
plans, and the service plans will cost a certain amount of money per month. So when they're projecting out, if that individual stays on the service plan through the remainder of the year, it will take up this much of the resources. So
I'm sorry, you're saying to account for people who are already receiving
Yeah.
services, you're reserving the remaining choice funds.
Yes.
So you're projecting that the available choice funds for fiscal 25 will be expended to meet the needs of those who are already receiving services. And that's why the waiting list is growing, because certain AAAs can't add new people if the existing service plans are projected to run out the appropriated funds. For
Exactly.
fiscal 25.
Yes.
Right.
And each AAA manages that process on their own, within their own agency, based on their local resources, how they allocate funds
Yep.
between different programs when feasible.
So do you have a breakdown of how many people there are on the waiting list for each AAA?
I do.
Well, don't keep us in suspense.
Oh, do you want? It's tiny
Can
font.
you run through it real quick, or
I can.
please?
And I'm going to have to put my glasses on because I can't see it without. Okay, area 5 has, no, area 1 has 5. Area 2, 129. Area 3, 321. 4, 278. 5, 235. I want to make sure I'm following the line. 6, 434. 7, 393. 8, 192. 9, 48. 10, 48. 10, 255. 11, 25. 12, 1. 13, 268. 14, 1. 15, 340. And 16, 1.
Can you tell me 11 and 12 again, please?
11 is 25 and 12 is 1.
Thank you.
Uh-huh.
So obviously we have 4 AAAs that have a very small number, in 3 cases 1, and in 1 case 5. So is that going back to your earlier comment, is that based on their management? In other words, I guess another way to ask the question is, does that possibly understate the need in those areas? Are they?
It does. So
Okay.
if we're looking at the spending pattern and the wait list, there's not always a consistent correlation. Again, just varies based on what local resources they may have to wrap around how they track their wait list. So just because somebody has 434 people on the waiting list, that does not necessarily mean there's not a need in one of the areas that has the smaller amount.
Okay.
But again, we'll be looking at the spending, reaching out to the AAAs to see if any kind of the shifting around of the funds may be beneficial.
And areas are by the counties, correct?
This covers all 92 counties.
But the areas designate, like 1 is a county, 2 is a county. Is that what the areas are?
No, they're each of the numbers represents anywhere from 2 to, I think the largest might be 9 counties.
Oh, okay. Oops, we got it.
So,
Oh, there it
Rebecca
is.
pulled the map up. There's the map. That's an 8. Mhm.
Okay, I've got one more question. This is Representative Jackson.
Thank you so much.
Thanks, Rebecca.
Do you have an estimated length of time these 2,900 individuals have been on this waiting list?
I do not.
Okay. All right, thank you.
You mind going back to that area map, please?
And I can also send it out
You can
and
send-
follow
that'd
up.
be great.
Mhm.
Send it out.
Yes.
Thank you.
The map is back on the screen, and I dropped a link in the chat to the AAA map on our website.
Thank you.
I'm also curious as to why some of the areas have quite larger numbers than others that I would expect. To be honest, I would think the area 8, Marion County and surrounding, would be a higher number than you'd say area 6. Kind of more of the rural counties. Would you know why that would be?
Each area maintains and manages their own waiting list. And while there are parameters around the process, there can be nuances between the different areas. So I think there's a lot of variability in those processes.
Okay. Thank you.
Are there any other questions for me? Those are all the updates I have today.
Thank you.
All right, thank you.
Okay, thank you so much, Ms. Erin. We will go on to our I4A update with Ms. Hannah Carlock. Thank you.
Good afternoon, everybody. I am Hannah Carlock, and I am the current interim CEO of the Indiana Association of Area Agencies on Aging, and we have had some change in leadership. So Jenny Hamilton, who is also in the room with me, is our new I4A board chair, and then Laura Holscher is our public policy committee chair. So appreciate them being here with me today. We do have some legislative priorities since we are now in legislative session. And our bill that we are hoping gets across the finish line is House Bill 1391, which is authored by the Choice Board's very own Representative Clear, along with Representatives Ledbetter, Goss, Reeves, and Shackelford. This expands the services of the Choice program to allow for dementia care coaching for caregivers. It decouples the Choice program from Medicaid and allows the division to negotiate rates for services based on the availability and access to services, allows for AAAs to be contracted and subcontracted for level of care assessments after the July 1st date when the state switches to Maximus. The bill has been assigned to the House Public Health Committee, and this morning we met with Chairman Barrett, and he is very interested in the bill, and we are going to continue having those conversations. Probably the most important bill, actually it is the most important bill of the session, is House Bill 1001. We are still waiting for that to be released. It will be the governor's budget, and he just took office this week, but Chairman Thompson will be authoring that bill, and we will be keeping tabs on that. We are actually working with Chairman Thompson and Representative Clear on the line item for the Choice program. So we would definitely like to keep that line item in the budget. Right now, $12.5 million gets reverted to the Medicaid waiver program out of the Choice line item, but we would like to see that money stay within the Choice program. So we have asked for that. Mark your calendars for March 18th. It is Senior Day at the State House. It is from 9 a.m. to 3 p.m. There'll be multiple panels of industry leaders along with legislators, and a lot of our I4A leadership from across the state will be spending the day meeting with their legislators and educating them about our legislative priorities. On the federal side of things, there was an end-of-year legislative package. However, we did not see the Older Americans Act reauthorization included in that package. So we'll be working with Indiana's new congressional delegation on reauthorization. The end-of-the-year package did include a short-term continuing resolution to extend the 2024 fiscal year through March 14th, and it reauthorized the funding for the Medicare Improvements for Patients and Providers Act, which includes funding for SHIPs, AAAs, and ADRCs through March of this year. Lastly, we are excited to announce the Humana Health Horizons in Indiana grant. Humana awarded a $150,000 grant to be dispersed by I4A to all AAAs across the state. This grant will be used to provide eligible recipients with direct financial assistance to prevent eviction, mortgage default, and utility disconnects. This grant is for Hoosiers 60 years or older and meet certain financial qualifications. Recipients may be awarded up to $2,000 with proof of threat or notice of eviction or disconnect, and each recipient will also receive financial management educational materials. This grant runs through November 30th of this year, and I'm happy to take any questions.
What was the date in March?
It is March 18th.
March 18th. Thank you.
Senior Day.
Senator, oh, I was told not to do it, I don't know why you're there. I mean, Representative Clear, I did receive the information today on your bill. Would like to talk to you about that offline. 1391.
Yeah, the bill Hannah just talked about.
She just.
Yep. Yeah, I think it's an opportunity to, among other things, obviously, there's a lot going on in the bill, but it's an opportunity to re-emphasize the value of the choice program and make changes that can help choice not only serve more individuals, but also give the AAAs a greater role in doing outreach and education and activities aimed at prevention, so that hopefully fewer people will need expensive services and can receive less expensive services earlier to prevent. I keep using prevent and prevention, but that's what we're talking about here. Prevent the need for more expensive services, whether it be through choice or through waiver.
Yes, sir. Well, let me know how I can support you on the Senate side.
Absolutely. Thank you.
Thank you.
Thank you.
That's awesome. Thank you so much. That was a lot of information, but very, very exciting. Exciting new stuff to look forward to. Any other questions or comments, concerns before we adjourn? Okay, well, we look forward to March 18th. Again, is Senior Day, and then a few days later is our next meeting on the 20th. So we will see everyone then. Thank you. Motion to adjourn.